oblique attaches from the abdominal aponeurosis, the lateral 2/3 of the inguinal ligament, the iliac crest, and the thoracolumbar fascia, and then it's going to insert into the lower 3 ribs, so ribs 10, 11, and 12. And because it crosses the ribs, the trunk, and the pelvis. Hey everyone, Steven here with Team Euphoric, and this week's YouTube shorts are dedicated to the internal oblique muscle. The internal oblique is one of your abdominal muscles. It's deep to the external oblique, and one of its actions is going to be retroversion of the pelvis, which makes it a very important muscle, especially in managing something like low back pain. If you recall from earlier videos, one of the reasons why most people develop low back pain is due to dysfunction in the lumbopelvifemoral complex, and one of the most common postural faults in the lumbopelvifemoral complex is going to be excessive anteversion of the pelvis or an anteriorly tilted pelvis. So because the internal oblique is responsible for retroversion of the pelvis, one of the ways in which we can mitigate this and decrease symptoms of low back pain would be to do some strengthening exercises for the internal oblique muscle. For the internal oblique, there are only 2 areas that we need to be covering, and that is going to be the pelvis and the rib cage. At the pelvis, this right over here is your ilium, and on the side we have the iliac crest, and that's the only important bony landmark at the pelvis that we need to make note of. Now let's move up to the rib cage. At the rib cage, the 3 ribs that we really need to pay attention to are going to be ribs 10, 11, and 12. 10 being the bottom of your false ribs, and then 11 and 12 being your floating ribs. But those are the only important bony landmarks when discussing the internal oblique muscle. The internal oblique attaches from the abdominal aponeurosis, the lateral 2/3 of the inguinal ligament, the iliac crest, and the thoracolumbar fascia, and then it's going to insert into the lower 3 ribs, so ribs 10, 11, and 12. And because it crosses the ribs, the trunk, and the pelvis, we know it's going to have an action in all 3 of those areas. At the ribs, its main action is going to be depression of the rib cage. At the trunk, when they contract bilaterally, they're going to be responsible for flexion of the trunk. When they contract unilaterally, they're going to be responsible for lateral flexion of the trunk and ipsilateral rotation, so rotation to the same side. And then at the pelvis, when they contract bilaterally, their main action is going to be retroversion of the pelvis or posteriorly tilting the pelvis. And then when they contract unilaterally, they're going to be responsible for ipsilateral elevation, so elevation to the same side, and also contralateral rotation, so rotation to the opposite side. But those are the actions of the internal oblique muscle. The internal oblique is innervated by the intercostal nerves, and more specifically the ventral rami of your T7, T8, T9, T10, T11, T12, and L1 nerve roots. And the reason that's going to be very important is because if we have any type of damage or compression to the nerve roots in those areas, then the nerves are not going to be able to send the proper signal to the internal oblique to fire properly, and that can lead to limited blood flow and oxygen in the area. So what we can do to address that would be to do some ELDOA exercises. The reason the ELDOAs are going to be so great is because the whole purpose of an ELDOA is to create space within a joint. So if we're able to create space within the joint, we can improve the function of the nerve roots, and then the nerves are going to be able to send the proper signal to the internal oblique to fire properly, which can improve blood flow and oxygen in the area. Today I'm going to be taking you through some strengthening exercises for the internal oblique muscle. I'm going to be taking you through 2 different variations, each of which are going to be in a supine position, meaning you're going to be laying down on your back. This first one's going to be for the supraumbilical fibers, so your upper abdominals. You're going to flex the knees to 90 degrees, plant the feet firmly on the floor, retroversion of the pelvis, flat lumbar, flat thoracic, keep the chest elevated with contralateral hand, cup it over the shoulder with the ipsilateral hand, maximum extension of the wrist, maximum external rotation of the shoulder. And the principle of action, we're doing a combination of lateral flexion and flexion of the trunk. And this is for the supraumbilical fibers. Next, if we want to target the subumbilical fibers in the lower abdominals, we're going to take the ipsilateral leg, flex the hip and knee to 90 degrees. Then we're going to take a contralateral leg, wrap it up over top, arms at the level of the glenohumeral angle. Then we want to do a combination of lateral flexion, and then we want to drag the knees up toward the sky. And this is to target the subumbilical fibers. Those were the 2 strengthening exercises for the internal oblique muscle. For the internal oblique stretch, we're going to be in a seated position, and we want to take the ipsilateral leg, or the leg of the same side that we're stretching, and we want to project it forward. We're going to straighten out the knee, go into dorsiflexion of ankle, inversion of ankle, and medial rotation of femur. With the opposite leg, the contralateral leg, we're going to flex the knee to 90 degrees, place it over the leg. Then, what we want to do is we're going to take the ipsilateral shoulder, and we're going to project it posteriorly. At the spine, we're going into anteversion of the pelvis, and a slight extension of the lumbar spine. And we want to do a contralateral side bend by bending away from the side that we're stretching, contralateral rotation by rotating away from the side that we're stretching. And then at the cervical spine, we're going to mimic what we did at the spine. We're going to do a contralateral side bend by bending away from the side that we're stretching, contralateral rotation by rotating away from the side that we're stretching. And this is the myofascial stretching exercise for the internal oblique muscle. For the T17 ELDOA, we're going to be in a seated position. We want the feet together, and we're going to flex the knees as much as we can until the lumbar spine starts to round. As soon as the lumbar spine starts to round, we're going to stop right there. We want to create a lemniscate in the lower body to get maximum myofascial tension in the lower extremity. We're going to do that by raising the big toe up, flattening the medial arch, going into external rotation of tibia, medial rotation of femur. Keep those knees nice and tucked in. At the pelvis, we want retroversion of pelvis, Flat lumbar, flat thoracic, chin tucked in, crown and head up, eyes looking down at the floor to put the dura mater under tension with the arms, maximum extension of elbow and wrist, maximum external rotation of shoulders, flex the shoulders to level of drum plane, so biceps in line with the ear. Then we're going to lower the arms to the level of the glenohumeral angle. If you don't know where that is, depending on your morphology, anywhere from 90 to 135 degrees. For the average person, when your arms are fully extended, the palms at the level of your forehead or slightly higher, that's going to be your glenohumeral angle. We're pressing away with the palms, up with the crown of the head, keeping those knees together, and this is the T7-T8 ELDOA.